So as far as what you've seen in the field, what have you seen not work in the field that people talk about?
The principles and it's a better way to say this. So you've got principles that have to be met. So they're the foundation of how something is done. So for example, we talked about direct pressure being the method for controlling an aggressive bleeder. That is a principle that has to be done. Now, the technique in which you accomplish that task can vary greatly. So that's where a lot of times in the students that I've had, even in the professional environment, tier 1 guys, they can get a little bit confused because they might hear one person say one thing and another person say something else. Well, Oz said I can put my knee on the injury site and that would make a doctor cringe. Well, yeah, it's bad medicine technically, but you're saving a life. So there's a medical decision that's always made with every intervention. So you get to a point where you kind of have to make a decision about how much good is this going to do versus how much harm it might do.
Right.
And I think anyone that watches this video might think that some of this medicine is aggressive, but we have to kind of re-emphasize that we're talking about emergency management of a patient who would otherwise die if we don't control the bleeder, or otherwise die if we don't open their airway, or otherwise die of hypothermia if we don't cover them. So it should be aggressive because we're talking about, saving someone's life. So things that I've seen that don't work typically fall back on someone violating those principles. So a principle would also be creating that power ball. If you don't create that power ball and you don't maintain positive pressure, if you violate that principle, it doesn't matter what technique you use, it's not going to work.
Right.
So the techniques can vary between anybody. I mean, personal preference, operation, the environment, equipment that you have. The main principle of the whole intervention is that it meets the requirement of that principle. It meets that principle, and it does that in whatever way it can the most effectively. So I think that's really, really important for people to realize that this isn't the only way to do this stuff. This is the way that I think makes the most sense to people that may not have had a lot of experience doing it. So instead of talking about some of the coolest stuff that's out there, the newest stuff, the focus should be a mastery of the basics, just
Right.
like it would be with rifle marksmanship or pistol marksmanship. There's no advanced, training in pistols and rifles. There's just mastery of the fundamentals. And it's the basics that save lives. I think anybody in the medical field will tell you, those few things that we talked about, airway management with the NPA or the head tilt chin lift. A lot of this stuff needs to be visually seen, and we talk about it, and you can look some of it up. If I had the perfect environment right now, I would have a classroom area, and I would have a board, and I would have a computer screen set up, and I would show you guys all this stuff. But it's it's just a talking point at this moment. But most airway emergencies, simple head tilt chin lift will straighten up the airway and allow that person to breathe and minimize the occlusion of the tongue. The recovery position is just simply rolling someone onto their side. Typically it's on the left side, and you can accomplish that by walking up to an individual who's unconscious, unresponsive, bringing their feet together, bringing their arms together. Then on the side that you're going to roll them on, you take their arm and you put it over their head. Now when you have that arm over their head, you're going to grab them at the waist and grab them at the shoulder, and you're going to pull them towards that side. As I roll towards that side, this arm is going to support my head, and I'm going to lay on that side. So now I've maintained a straight head as much as I can. The purpose of that position is that it allows gravity as you're laying on your side to keep your tongue from falling back and becoming an occlusion. But also, one of the most typical things that we see with head injuries is we see nausea and vomiting. Okay. The other place that's very common to see nausea and vomiting is in the event when someone drinks too much. So when you've become intoxicated, it's very common to throw up. So that position allows a person to throw up without aspirating or inhaling the contents of their vomit, which can kill them. So the recovery position requires no training. There's actually a video on YouTube. I don't know if you've seen it. And I'm not promoting violence. I think violence does solve some problems if correctly applied. However, the video is of a guy who gets into a confrontation. It's about 15 seconds long. So he gets into a confrontation with somebody else, and one individual smacks the other one on the side of the head so hard he knocks him out cold, completely out cold. The guy is on his back, flat, unconscious, unresponsive. The guy who hits him walks up to him, puts him in the recovery position, and walks away.
Yeah, I saw that. Now that you said it.
It's pretty funny if you recognize what he's doing, but that's a very considerate assailant. He basically said, "Hey, you know what? You're unfit to control your airway. I'm going to roll you to the side and make sure that you keep your airway open." So it does work. It's a very, very simple maneuver. So the NPA and the recovery position, or the head tilt chin lift. We haven't talked about the jaw thrust. Essentially, my perspective on the jaw thrust is that if someone has the potential for cervical spine injury, the thing that's going to kill them more likely is the lack of oxygenation to their cells or suffocation. Okay, so if you haven't been trained and all you know how to do is to put an MPA in and you can't do it without manipulating the head a little bit, or you remember the head tilt chin lift but you don't remember the jaw thrust, that is a decision that you make as the person on site to say, hey, yeah, it was a car accident, but I can't remember what to do. They're not breathing. I need to do something. That's on you. You make the call, just like anybody else would at that point, to do an intervention, knowing that it might hurt somebody, but it could save their life, probably will save their life, or not. So that's where the Good Samaritan thing kind of comes into play. Yeah, you saw that person, fell from a building, and you knew that there was a possibility their back was broken. Then why did you roll them over? Well, because he wasn't breathing and he was gagging on vomit. Okay, so a reasonable person would say, yeah, you know what, he's gonna suffocate in a couple minutes.
Right.
So that risk thing, again, you kind of have to weigh it.
Yeah, and that's kind of what this video is about, for kind of spark people's, brainwaves a little bit. And if we're talking about it, research it, go out and look into it, maybe take some classes and learn about it.
Yeah, there's a lot of good classes out there. If you take like an EMT basic, you're going to spend 90% of your time focusing on the legalities of medicine, implied consent and all the other legal aspects that go into actually putting hands on to somebody else with their consent or without their consent. So EMTB is talks a little bit about anatomy and physiology, but essentially EMTBs aren't qualified. They're not allowed. I shouldn't say they're not qualified, but they're not allowed to really practice any medicine. So you don't really start to see medicine until you start to move into the EMT intermediate or paramedic level. There was a intermediate 85, which could push some drugs. So it was EMTB, EMTI. I kind of went into the I-85, and then it went into EMT paramedic. And the paramedic is the most skilled medical provider on the scene. So typically your paramedic courses can be a year long. That's a lot of commitment. They're expensive. They're not cheap. So it's not very common for someone just to go get their paramedic license unless they're going to be a paramedic and work on a firehouse. So it's unlikely that you'll see that aggressive airway management or the medical stuff at that level. So the EMT is a great place to go, but I think there's a lot of other courses that are available for people, wilderness medical courses and stuff like that. Some of them have prerequisites. You can imagine being a medical instructor who is being asked to teach a class on, let's say, advanced medical procedures, and none of your students know any anatomy or physiology. So it doesn't make a lot of sense. And so that is why a lot of these courses that you find have a prerequisite. They want you to be either an EMT or a paramedic, or they want you to be a combat lifesaver, or they want you to take their set classes,
right,
level ones, before you can take some of the more sophisticated medicine. And that's really wise, because medicine is an ever-evolving thing. Your patient was stable 1 minute, and now he's unstable. Well, why is that patient unstable? One of the biggest factors in treating a patient is recognizing an abnormality. And it sounds like it would be an easy thing, but you'd be amazed under distress how much common sense flies out the window. You'd be amazed that while you're packing that wound and you're sitting there looking at that injured leg, you totally forgot to even check to see if the patient was breathing or had a pulse. So some of those things are, they become challenging in a stressful environment. So that's why training is important. I think that you have to be able to identify a person having difficulty breathing. So what's adequate breathing? I mean, you'd think that would be easy to answer, but you ask someone that question, you go, hey, what do you think is normal breathing for an adult male or adult female? And they don't know. They've been doing it their whole life, but they never paid enough attention to go, well, how many breaths am I taking in a minute?
Right.
What does my breathing sound like? What does it look like? Essentially, a person should be breathing between 12 and 20 breaths in a minute. So that's a rise and fall of the chest, indicating one full respiratory cycle. So rise and fall, 1. Rise and fall, 2. So how do you count your minute in that? Well, you either grab your stopwatch and you count and you look and feel, or what you can do is you can count the seconds in between each rise and fall, which is another technique. So I have a rise and fall, I count 1,000, 2,000, 3,000, rise and fall, 1,000, 2,000, 3,000, rise and fall, and I have the same consistency. If you don't have it consistent every time, you look for the average. So I go, okay, that person is taking one breath every 3 seconds. How many times is that in a minute? Well, there's 60 seconds in a minute, right? So how many times does 3 go into 60? 20 times. So that's 20 breaths a minute. That's just one aspect of monitoring respiration, because now you got to consider the quality as well. So you can see that something as simple as breathing actually requires a little bit of training and knowledge to be able to recognize that someone, yeah, they're breathing 25 times a minute, and that falls, basically in the parameters that Oz said, but their breathing is making a lot of noise, or it's irregular, or they have unilateral rise and fall of the chest, only one lung is inflating. There can be a lot of things that go wrong, and if you don't know what to look for, how could you be expected to fix it?
Right.
So it's really important to acknowledge what you can and cannot do before you find yourself, in hot water.
Yeah. So let's end on this. Do you recommend anyone to have anything in their kit that they don't know how to use? Or would you say, someone might say, hey, I might have it in here, I don't know how to use it, but maybe someone who comes along would?
Let's see. We talked about hemorrhage control. A tourniquet, I think, is a really, really good tool. I think that it has saved countless lives. I think that a lot of people have a misconception about the tourniquet. I know that even EMS for a long time wasn't putting tourniquets on. There's stories of guys that have been injured in a civilian setting. Somebody had a tourniquet, put it on there, saved his life. The paramedics showed up and cut the tourniquet off because they didn't know what it was, and then had to apply pressure again. So I think with the amount of information that's open on the source on the internet, I think there's no excuse to not kind of have some knowledge base. None of the stuff that we're talking about is classified in any way. None of the medical stuff is considered classified. So even the Special Operations Medical Schoolhouse information is open source. A lot of it can be found. So there's really not a lot of things that I would say you'd have to focus solely on. I think the trick is in an understanding what an injury does to the body. So a little bit of knowledge about anatomy and physiology. Then understanding what does the body normally do versus what is the body doing now. So recognizing irregularities. So I think the most challenging thing is to educate yourself, because it's not one of those things where you can just kind of do it on the fly. You actually have to spend some time, take an interest in it, and actually learn it, and then ask questions. Ask why. Medicine is a big why thing. He's breathing fast. Why? I can't solve the problem. It's the why that's the trick. It's not the how or the what. It's the why. Because
Right.
the why tells you how to fix it, because you have to reverse that why and create a solution. That requires cognitive thought, deliberate thinking, deliberate decisions, and time is critical in a medical emergency. So to long-wind your story, your answer here, essentially, I don't think that there's any one tool that is good to carry that somebody else might know. I think that if there's anything in your medical kit that you carry, it should just be things that you are skilled in or that you've trained your family in. And I think it's really smart to teach your kids some of this stuff. You you go. I went to
Exactly.
A college campus, and my mom ended up giving the lady CPR. There's a lady that just passed out right behind us in line. Hit the ground, had a seizure, stopped breathing, and my mom looks around. My mom's a nurse. My mom looks around, and the mother of the daughter that just passed out is just sitting there, has no idea what to do. So my mom kind of hesitated for a little bit because she didn't have a mouth shield. And then she was like, you know what? I got to do this, I guess. So right there, I'm standing in line in college, and my mom starts giving this girl CPR and saved her life. And I think they gave her like a mug from the university or something as a thank you. But she was the most highly skilled person. She didn't have any equipment. She didn't have any medical gear, but she knew what was wrong, and she recognized the danger. And because she knew what was supposed to happen, what needed to happen, she saved a life.
Right. So it wasn't equipment, it was knowledge.
Yeah, and most of the time what you'll find is that the best medics are the ones that can find ways to overcome their obstacles despite the deficiencies in their equipment. That's why, like the 18 Delta course, we have no cool stuff. We have sticks and rags and the cheapest, most primitive gear to work off of. We don't see the cool stuff until we go to our units and they go, hey, look at this thing. And you go, wow, that's so much easier than the way that I've been doing it.
Right.
And the reason is very, very simple. You go to a place in Afghanistan, in the remote mountains, and you break a piece of equipment, or you've got a mass casualty where you've got more patients than you've got equipment to treat. Now you've got to improvise, and we talked about improvise for the tourniquet. If you understand what a tourniquet is supposed to do and how it's supposed to work, it's a very simple thing to create. And you can look up improvised tourniquets on the internet and see that it's a really, really simple thing. You can't use a shoelace because it'll cut through tissue, but you can improvise a belt, you can improvise clothing to make a tourniquet, and you look around for what's around you to support the needs. That's mastery. In my opinion, when somebody can look around and make something fit the need, that's mastery in and of itself.
Yeah, definitely. I definitely agree. Yeah, I'm just trying to think about what you're talking about with the tourniquet and just making it out of nothing. Yeah, it's definitely mastery and knowledge. So what we're going to do is we're actually going to break down and do some videos beyond this. This is just more of a kind of introductory and talking about knowledge versus equipment, if you will. So you have anything else you want to add before the video ends?
No, I think that if people can walk away from this and recognize that there's a lot that they can do, which is at a very, very basic level. You don't need a paramedic, you don't need a doctor, you don't need a surgeon, because the most important person in the chain of custody for that injured person is the person closest to them. That is absolutely the most important person in the world to that person. And I'm pretty sure that I can say this with 100% certainty that the best trained Harvard graduate surgeon in the world can't do much with a dead body. So if
you gotta get in there.
What you do allows a patient to move from point A to point B being the surgery room, the operating table, with a pulse and breath coming out of his lungs, you've done a lot. Now it's in their hands. So don't cut yourself short. You are the most valuable person in the world to that person. Not the surgeon, not the paramedic, not the police, but whoever it is right there. And opening up an airway, stopping a bleeder, and keeping a patient from going hypothermic I can't imagine how many lives would be saved if even half of the people out there walking the streets knew even half of this information.
Yeah. All right. Well, we'll break down some other videos in the future here, but thank you for your time. It's always appreciative. I'll put links down below to all your links and where people can find you, and we'll see you on the next video.
Sounds great. You guys have a great one.
All right. Thanks.